Hi everyone. We have made this video to help answer commonly asked questions to care for the COVID positive patients. The idea behind this was that we would have a avenue that we would have the same message being given to everyone at the same time with the experts. So we have Janice and Wendy, both from Infection Control, and Baby John and Jancy, our clinical nurse leaders. So Janice, if you could briefly go over the basic PPE requirements for the care of the COVID patient.
Sure. When you're not in the room, of course, you can wear a surgical mask. But to enter the room, you're going to have on shoe covers, then you're going to put on a gown. And for the gowns, you can have disposable or the washable, reusable. You're going to wear gloves. Always perform hand hygiene before you put your gloves on. And you're going to wear an N95 when you go in the room. And you need to have on either goggles or a full face shield.
So you mentioned washable gowns. So how would I properly doff the washable gown?
It can be a little more difficult than doffing a disposable gown. But when you put it on, when you tie it in the back, tie it in a bow tie that is easily undone so you don't get knots. And the main thing to keep in mind is when you reach behind you to untie it, that you try to take it off with as much caution as you can to keep from contaminating yourself with the front of the gown. But one of the things that you can do is a buddy system. You can, when you open the door, have someone come to the door, and you can turn around and have them to untie your ties.
What is the best way to store the reused PPE, like my N95 mask or my goggles? What's the best way to store that?
So your N95, of course, we talked about the mask. I know that process is out there about putting it in a paper bag, an open paper bag. But the other things like the eye protection, you really need to not put that in the same bag with your mask. You need to either put that in a separate bag, or you need to, I know some areas have actual like hooks on their cows, or some of them have hooks outside the patient room, I think on the what is it called, the PPE organizers. You can hang your clean goggles or face shield there if you need to, but making sure you always clean those too before you put them anywhere.
Can a COVID patient be placed in a regular room with no negative flow?
That is perfectly acceptable. I know early on there was a lot in the literature, and we were telling people that you had to have them in negative flow rooms. That is not the case now. They can be in a regular room, no negative flow.
Do we change PPE between the same patients if they're in a shared COVID positive room?
If patients are in the same room, they should have, they're cohorted in the same room, COVID positive, then you leave your PPE on. The only thing we ask is that you change your gloves and you make sure you perform hand hygiene between patients.
What do I wear when I transport a PUI or a COVID patient?
You would wear your N95 and your gloves, and you would have a mask on the patient, a surgical mask on the patient. You can also, for the bed, you can clean the rails, or you can put a sheet over the bed rails.
And if there was a situation where you had to be actively caring for that patient, whether it's like, they won't keep their mask on or there's something going on, then you can wear a gown if you're going to be active while you transport them.
Okay. If I were discharging a patient, would the same PPE requirements would it be the same?
It would be the same, yes.
And can we call an escort if we are discharging a patient? And what would their role be when we are discharging the patient?
That's a good question, and you can do that, and their role would be like pushing the elevator buttons for you.
Like a marshal?
Like Marshall.
Do I need to double gown?
No, do not double gown. We don't recommend that.
Some of the staff have expressed concern about if a surge still does happen. So if we have a whole bunch of patients in the ED and they need to get up to the unit. What is the process for cleaning the rooms prior to admitting the patients? Like, how long should it take?
It's the same process we've always used for cleaning rooms, but we are using the True-D. And so if the True-D is used in the room, it usually takes about 45 minutes.
How long can I use the face shield for?
You can use the face shield until it becomes damaged or like the strap gets broken, that sort of thing. So you do not throw it away at the end of if your shift is still in good condition. You just need to make sure that you're wiping it with alcohol to keep it from, to disinfect it.
What PPE do I wear when I go from a COVID positive room to another COVID positive room?
When you're going from one room to the other, you're going to remove your gown and your gloves. You're going to do hand hygiene, but you can leave your N95 and your face shield on.
Do I keep my shoe covers on?
No, you take
Oh.
your booties off,
Okay.
and we do not want those worn in the hall.
Okay. What if I'm going from a PUI room to a COVID positive room?
It's the same process.
Okay. And would it be the same process if I was going from a COVID positive room to a PUI room?
Yes.
Can I wear the shoe covers out in the hallway?
No. You take those off with your doffing in the room.
Should the trash and dirty linen be treated any differently? Should I be double bagging, or what PPE should I be wearing if I'm taking out trash or linen?
The trash and dirty linen's treated just like any other trash or dirty linen. We recognize that some areas are double bagging, and the fact that when somebody's in a COVID positive room, they're taking the trash and the person on the outside of the room is holding a bag open for them to put in. That's perfectly fine to do. It's just not a requirement. And also, I did want to point out that the trash does not need to be biohazard. All that trash is not biohazard. It's the same as any other biohazard trash would be treated. Does that make sense?
Yes.
Okay. Does the elevator need to be clean after a COVID patient is transferred? So if I'm discharging or if I'm transferring to another unit, does the elevator need to be cleaned?
No, it does not, unless there would be some type of spill of blood or body fluid.
Yes.
If I'm caring for a COVID positive patient that passes away, what do I need to do?
So you would treat it like any other patient that passes away, and I assume you're going to have all your PPE, and then once you get them in the bag and you zip up the bag, you're going to wipe that bag down with disinfectant wipes, and then of course you would change your gloves and your PPE. But after you wipe that down, from then on, then anytime you touch the bag, you would wear gloves, but there's no other special precautions.
Okay, if I wanted more information about how to care for like postmortem care for the patient, or if I had more questions about if I'm going to transfer someone, where can I find that information?
Each unit is going to have a resource finder that the information, these policies or SOPs will be placed in.
Yeah. This standard of practice was created by the critical care leadership team and the ED doctors and nurses, and that is available for the entire staff to use. So a copy is located in the resource finder in every single unit.
Okay. All right. I think those have answered all our commonly asked questions. Thank you for your time, everyone, and have a great day.